world today, as I hear people calling in from, Hawaii, all to Canada, all to the U.S. I think nearly every state's represented right now. But for those of you who may be joining us for the very first time, let me start by introducing myself. My name is Cheryl Cortese. I am a National Marketing Director with the Juice Plus Company, and it's really, been an amazing experience to be with this company. I've been with them for 32 years, as a matter of fact, 32 and a half. And the adventure has been one that has been extremely rewarding and continues to be. So I want to give you a little background, too, about the company. If you're just joining us for the first time, the Juice Plus Company is actually 50 years old this year, and we have had quite a track record of success over all this time. The young man who started this company so many years ago, as a very young man, was Jay Martin. It was his baby then, and it's still his baby today. He certainly with the philosophy that if his partners in the field do well, then his company will always flourish. So that has been the thinking and the way that they have operated all these years, and it's certainly served everybody. The company itself entered the marketplace so many years ago with a product that you're probably all very familiar with today. We were the company that introduced smoke detectors for the home. And that, of course, was something that was not only well received, but is in everyone's home today. Diversifying over the years, we went into the field of water filtration and air filtration. Again, very, very successful. All of these lines, multi-billion-dollar product lines. And then 27 years ago, entered the field of health technology with Juice Plus and the Juice Plus family of products. So we have certainly set a pace for success, but if you think about it, it's really a company that has had the well-being of mankind in mind, service to people in the population, smoke detectors for safety, clean air, clean water, and with Juice Plus now for the past 27 years, pure food. And so very basic needs for, the entire population, and I think that's why we've seen such success. Over the years, and we talk about 30 that we've been gathering, we've had wonderful people come to our line here on Monday night to share their information, their expertise, information as well as inspiration. And they've done it really just out of the goodness of their heart and offering their time. And tonight we have a speaker that we all admire and love, and it's Dr. Suzanne Saidi Phillips. She's going to be our special speaker tonight, and I would like to tell you a little bit about Dr. Phillips. Suzanne is married to Dr. Paul Phillips and mother to three amazing daughters, ages 24, 21, and 18, and a bonus mom to three kids who are 25, 23, and 20. After finishing a degree in biochemistry and also a degree in Doctor of Dental Surgery from the University of the Pacific in San Francisco, Suzanne spent time in Finland researching migration patterns of oral cancer cells. Back in the United States, Suzanne continues to practice dentistry in San Francisco Bay Area after 30 years in this profession. She has built her practice on the playground, while raising her children and cherishing the relationships she's made over the past 3 decades with her community. She is excited to use this lifetime of health education and experience to motivate her passion, a part-time business encouraging holistic health and wellness. The business will additionally allow Suzanne to spend more time with her family and reduce her reliance on practicing dentistry every day out of financial necessity. Instead, she is working towards becoming free to choose dentistry a couple of days a week because she genuinely loves the work she does, but the power of choice has empowered her to offer the same opportunity to others and the role model for her daughters at home. So, we are blessed in our profession that, we can work from home or we can work in whatever capacity we're trained and do those things simultaneously. Tonight, Dr. Suzanne Saidi Phillips is going to share with you the gateway to health and what she knows about her profession and also how the Juice Plus products play an important part in that. So, Suzanne, maybe we can start with, why don't you share your story about yourself and, your family, and just let's have you meet people, okay?
Okay. Well, thank you, Cheryl, for that amazing intro. I want to start out by just thanking everyone for joining in to listen to what I have to say today. You're going to hear a lot of passion in my voice, and I may get a little bit choked up at certain moments because this is also a personal story. My journey with Juice Plus actually started 10 years ago, and at that time, my dear friend Loren Lahav shared Juice Plus with me when she came to see me as a patient. It immediately made sense to me as a mom and as a dentist. I had truly never heard anything like this before, so I became really curious. And I started my entire family and myself on the products right away. And I couldn't stop sharing with patients because, my practice is built, like Cheryl just mentioned, on the playground. What that means is it's built on relationships. And I knew that, you don't have good health unless you have good nutrition. And so I got super excited about it. And so that is basically the story that everybody knew from me. That's the story that I would share for a long time. I shared that story. But what I'm going to tell you on this call is the part that I didn't tell people. And the part that I didn't share was that my eldest of 3 daughters at the time was 12, and she was diagnosed just 3 years prior to that with a very rare autoimmune disorder. And the autoimmune disorder was a 3 in a million autoimmune disorder that took a very, very healthy child who had never been on medication, had always eaten healthy, and it took her from a place of health to a place of severe illness in a very, very short amount of time. Basically, within a year, she was in a wheelchair, and she was in a wheelchair at the time when, right before Loren met her. And so it was interesting because for me as a mom, I became curious and said yes to these products, without really knowing what the full impact would be. And so even though I had all this training and, as you heard, all this experience with research, I didn't know what the full impact was. And so when I said yes, I said yes based on nutrition that I knew that our family wasn't getting in our daily diet. And so what nobody really knew also is that I was going straight from my office to the hospital for Sarah's treatments, including IVs of chemotherapy, steroids, immunosuppressants, and the list goes on. And so it was a really, really tough time. And during that very tough time, I also became a single mom. And so I was growing my business organically. However, at the same time, I was struggling financially. And no one really could tell that because I am the kind of person who tends to just inherently keep a smile on my face, and I don't necessarily want to burden everyone else with what's going on. And also, when you're a healthcare provider, it's really not appropriate nor professional to be crying, every day or, with every patient. And so what happened was I had this professional front. I had this front on, but basically what was happening under, behind the mask, so to speak, was that I was struggling not only with my daughter's health, but financially. And so what happened then really amazed me. Within a short amount of time, Sarah started feeling the pain go away in her muscles. And then within about 6 months, she was able to physically move up and walk up and down stairs, no more wheelchair, no more assistance. And then within a year, she was starting to wean off her medications. And within 2 years, she was off her medications completely. And during that whole time, I thought it was strictly the medications and the IVs that she was already getting finally kicking in. And, by no means, I'm never one to make any claims about anything. So I truly believe that it was, the medicine, and that this was it was fueling her cells, which I still believe. However, then she went to college. She went to UC Berkeley, and she got really, really sick because she stopped taking her Juice Plus. She stopped her normal routine. Like anybody who has been to college or has had anyone close to them who's in college, you know that their normal routines basically go out the window. And so when she stopped her normal routine, she got sick, and she was hospitalized, and we went down the path of all the medications again. And luckily, we were able to I was able to control the medications that they put her on, so that they put her on some medications just short term, and then we were able to wean her back off. So as soon as we got her back to her normal routine, got her back to taking her Juice Plus daily, within a short 6 months, she was able to really feel healthy. And luckily that was about 6 years ago. So luckily we haven't had any problems. But the other part of the story I want to share too is the business side of it. During that whole time, I was actually building my business. Once again, it was through the relationships I already had, just sharing with people what was actually going on. And so I built a business unknowingly. And what really excited me was seeing that this business was something that I was building on the side. And what happened was about 3 years ago, I decided I didn't want to practice or own my own practice, I should say. And so I actually sold my practice a year ago. I decided 3 years ago, but I sold it a year ago. And as you can imagine, it's been kind of a life-changing experience, because I had been practicing for so long, over 30 years. And so I am still practicing, part-time, but it's so nice to be able to really immerse myself into my business, which is my passion, and to be able to really share with other people that are struggling in either their health or their wealth or both. So.
Well, and Suzanne, some of the things that, I think stand out in your story, and first of all, I love the fact that in sharing Juice Plus for many years, and all of the people on the line who do share Juice Plus with others, the wonderful, I guess you would say, emotional revenue, or the happiness that comes from hearing a story of anyone, especially children, that their lives, are somehow changed for the better. That always feels so good. But one of the things that really I take note in your story is that, Juice Plus came along, and it was something you did, but not with the intention that it was going to do anything other than help support nutritionally. But at the same time, nutritional support is so powerful, it creates such a foundation. I think that we see this over and over, that Juice Plus helps the body deal with whatever it has to deal with more efficiently. And that's always exciting, because that usually is the thread that runs through these stories. And I think that's the power of what we have to offer, is whatever the body's dealing with, it deals with it much more efficiently. But when you talk about building your business organically, we're talking about your Juice Plus business, it was just, I don't know that it was a thought, maybe you share with us, was it the thought that you were going to build a Juice Plus business, or did it just begin to happen because you realized the power of the product for your daughter and you wanted other people to have that as well?
Absolutely. That's the best way to say it, Cheryl. I really saw this business grow in front of my eyes by, sharing my experience, sharing my product story, sharing, what was happening as it was happening. Because, there was definitely a time when I was holding back and not really sharing a whole lot. But what I did notice was that when I did start to share it with, especially the certain community that already knew about Sarah, they would, come into the office and ask me a question: how's Sarah doing? And, and anybody that knows me knows that I'm going to, answer, the best I can. And so what I experienced was that everyone was so excited that they said, well, tell us more about it. And so I couldn't tell them about what had happened without mentioning Juice Plus. And so it was pretty clear that people wanted the information. And, the next question I got usually was, why didn't you tell me about this sooner? And so, it was really quite amazing in terms of my experience.
What I know, it became a desire to share it with everybody.
Yes, exactly. And I really have to go into this part. It's really something that I hope no one has ever experienced nor will ever experience, having a child with a chronic illness. It was just heartbreaking, to say the least, and there was so much uncertainty, and there really wasn't a lot of hope. Unlike my profession, where we see symptoms, we give a diagnosis, and then we have a treatment plan. Whether patients like to go to the dentist or not, the good news is we can we can go through all of that and give a treatment plan. In this case, for anybody that doesn't know about autoimmune disorders, unfortunately, it's not as simple as that. Typically, it takes them a long time, if ever, that they actually give a diagnosis, because it's typically very rare. Whatever autoimmune disorder it is, it's pretty rare. And so in Sarah's case, they had never ever, at UCSF, they had never ever seen a patient with this disease, let alone diagnose it. So in my practice, I definitely was kind of blindsided by that whole experience, and I really became very passionate about sharing what I learned, so that hopefully my thought was, gosh, if I can even help one person, one patient. I had no idea that I would ever be speaking on stage, regarding Juice Plus, or speaking on your calls, because this definitely isn't my comfort zone to be able to speak like this in front of people. But what I recognized is that it's my responsibility, because this product and this company has created such a foundational product. And to me, it's something that really needs to be spoken about a lot more often.
Oh, and I so totally agree. It's, it's a passion, but it's also a moral obligation. And
yes.
Especially as we find ourselves where we do today. Let me ask you another question. As a practicing dentist, maybe you could share with everybody why you do feel like recommending this to your patients is so important. I mean, what are the things that you know from your experience, as far as your educational background and your experience in your practice? Why do you feel like this is so important for people?
Okay. And so where I want to start with the answer is to really kind of clarify what my goal is, and I also need to go into some conditions that I'm going to describe. And so, to start with, the goal here of my talk tonight is I want everyone listening to really leave with an understanding that there is a link between your oral health and your overall health. Okay? So it's very, very important. I think, we in the dental community refer to this as the oral systemic health link. I don't know if any of you have heard of that before. Oral systemic health is the link between your oral health and your overall health. And so I've worked in dentistry for over 35 years. And, what I know is that in our practice, for instance, we see bleeding gums, we see inflamed, sore, or painful teeth and gums, we see visible infection, we see broken and or loose teeth. So, as you can imagine, we are dental detectives. What we see in the mouth actually has some kind of systemic effect, or something's going on systemically to cause that. So the systemic effects that I'm speaking of poor dental health are exacerbation of diseases like diabetes, cardiovascular disease, high blood pressure, hypertension, dementia, Alzheimer's, preterm or low birth weight babies, among others. And so what I've really found is that, to really understand that is to really dive deeper into, what are we talking about when we're talking about disease. So, for instance, as a dentist, periodontal disease and decay are the top two most prevalent infectious diseases on the planet. So I'm going to repeat that. So periodontal disease, which we've all heard of, okay, so periodontal disease is the inflammation and infection of the teeth, gums, the gum supporting and the bone supporting your teeth. So periodontal disease and decay are the top two most prevalent infectious diseases on the planet. So it's really important to know that when we're talking about systemic disease, we really have to talk about, what we're talking about specifically. And so to understand that, and then the question may be, okay, well, if those are diseases and that's the state of infection or disease, how do we get our health back? Like, what do we do? And so this is the hope part that I want to go dive a little bit into. And so first of all, the most important thing that you can start doing, today is to maintain good oral hygiene. Using a toothbrush, meaning an electric toothbrush is typically the best. There are a few patients that I've seen over the years that do pretty good with manual, but statistically, most people do a lot better with electric toothbrushes, and follow the guidelines. Typically, it's 3 minutes, and most people really brush a lot less than 3 minutes, so it's really important to understand that the length of time and the quality of brushing is really important. And so, one little suggestion that I have is to put a favorite song on. Just pop a song on your phone while you're brushing your teeth, because that can actually kind of help you relate to the amount of time that you're brushing. So flossing is very important. It is something that we all should do at least once a day. And, it's something that, you can do before brushing, after brushing, it doesn't matter. But getting that floss in there and really wrapping it up and down around both surfaces between each contact, it's really important. Because food tends to impact under the gum, and that is usually the area that we can't reach with our toothbrush. And so the other thing is soft picks. Some people like to use soft picks. I don't necessarily recommend them for people that have restorations in their mouth because they can pop things out. And so soft picks are really good as a gentle tool to kind of for extra massaging, but I wouldn't replace the floss with them. The other tool is a water pick. Water picks are really good for flushing any debris or food, little seeds, things like that out, because then, it kind of adds that extra dimension of water flushing through the pocket. But once again, it doesn't replace. The American Dental Association also says the water pick is endorsed. However, it doesn't replace regular flossing. So, and then seeing a dentist regularly, which means, in some cases 2 times a year, it could be up to 4 times a year with a complete exam and follow the prescribed treatment plan. That's super important. And next, so I only have 2 things. The next thing is, guess what? It's eat a healthy diet with lots of fruits, veggies, berries, antioxidants, and good fats like omegas. And so, that's the hard part, because there are so many people that I see that have a really tough time with that part. They say, gosh, you know what? They say, doctor, I have, I eat a salad. I eat, a veggie at least once a day with one of my meals. But I can't seem to get, the amount of fruits and veggies that are recommended, the 8 to 12 recommended per day. I can't do it, and I can't eat a varied amount of fruits and veggies, which is what the recommendation is. So how do I do that? And so this is the perfect segue for me as a dentist to be able to shine a light for them on, acknowledging what they're already doing and the awareness. Sometimes they don't have awareness, so then I'll kind of explain to them what, I'll ask them questions about their diet, and then they'll start talking about what they're eating. People love to share, what their diet looks like. And so then we'll create a conversation around that. And so usually it's a really good segue for me to talk to them about the omegas, the plant-based omegas that we have, to talk to them about, the Juice Plus different plant powders that we have, and, the fruit, veggie, and berry blends. And so, when I share that, it's a pretty simple share, and it seems, just like with me, it just seems to make a lot of sense to them. And I also explain that, to them that, periodontal disease, like I shared earlier about my daughter, periodontal disease is an autoimmune disorder. It is your body attacking itself. And so a lifestyle change is a must for us to see any decrease in inflammation and periodontal disease. So there are patients that will come in, and I've heard this from my colleagues in dentistry as well as in medicine, that, you know, we can only do so much with our tools and our resources. And there are patients that say, gosh, you know what, doc, I've done so much better with my brushing, my flossing, my water picking. I've come in when you told me, and I followed the treatment plan, you know, but what's going on? Why do I still have inflammation, or why do I still have increased rate of decay? And what do I go back to? It's what I told you earlier, that periodontal disease and decay are the top 2 most prevalent infectious diseases on the planet. And the reason why is because of diet. So that's the thing, is that you can maintain everything that I just told you about your oral hygiene. You can go to the dentist. You could be the exceptional student with all of it. But if you are eating poorly, if you're not eating fruits, veggies, berries, antioxidants, good fats like omegas, then unfortunately you're not going to really gain anything on the attack that your body is doing on itself. So you don't have to be a victim of poor nutrition, I like to say, and you don't have to be a victim of your genetics. You know, there is a way to change that. So, and that's where the conversation about Juice Plus products come into play.
And what have you seen with this over the time that you've been sharing with people? Because I know that you are very passionate about it, and like you said, you know, I think for any of us in the population, and now certainly more than ever, a good diet is hard to maintain.
Yeah.
So
it's so true. Mm-hmm.
And with Juice Plus, what have you seen in your practice over the time you've been sharing it with people?
Yeah. So, you know, having good oral health is foundational to good systemic health. Which is vital to fending off, you know, the seasonal flus, colds, allergies, and the challenges we all face today. What I found, you know, a couple areas to note is that the clinical research that we have, by the way, I did oral cancer research before I started practicing and after I completed my dental degree. And the clinical research we have is gold standard. It's double-blind, which means that it's the highest level research that you can get, and it's placebo-controlled. So it's basically, the clinical research has shown that periodontal health improved in patients undergoing periodontal therapy more in the Juice Plus group than the placebo group. And what's interesting is that they did the study on patients that had, you know, on the kind of mild periodontal disease or mild inflammation side. So as my husband pointed out, who's a dentist as well, he pointed out, which is very true, that, you know, if they would have done it on patients that even had a little bit more moderate to advanced periodontal disease, I think the impact, you would have more than likely seen even greater impact. So they went on an even more difficult population of patients to prove their point, which really says a lot about our company, and I don't think that most people know. So that's one area. The other area that I've seen is definitely decreased inflammation. I mean, what's interesting is that these same patients, as you can imagine, I've had these relationships for, you know, over 30 years with a lot of my patients. And even though I sold my practice, I'm still friends with a lot of them. And I kept telling them the same things over and over again, and nothing would change. And for the patients that said yes to me and started on Juice Plus and nothing else changed, meaning their dental history didn't change, their medical history didn't change, their genetic history didn't change, they didn't change anything. Let's say they gained a little bit from the resources and the tools and the different, you know, oral hygiene techniques and the prescribed treatment plan methodology, but they would hit a wall. They would kind of basically get stuck and not gain anything more. They still had inflammation. They still would get decay. And for those patients, when they started, now I'm not saying every single one said yes, but for the majority that did say yes, they actually saw the inflammation decrease on it completely. And they literally came back to me and would say, wow, you know what, I wish I would have said yes to this sooner. And so what I've seen is that as a doctor, but I like to really call myself a dental detective because, what we see in the mouth, everyone can see in their own mouth. Everyone that is having any experience with bleeding gums, it's not normal. It's not normal. So it's very important to note that there's something missing. And what is usually missing, especially if you're doing all the right things with your oral hygiene techniques and going to your dentist, then what is usually missing is that key component, which is the flooding your body with antioxidants, which with all the colors of the rainbow, with the good fats like omegas. And once we bridge the gap for them, and once we really have people become mindful, then they get that wow experience, and all of a sudden the inflammation is gone, and we're not only helping them and healing them orally with their oral health, but we're helping their overall health, their systemic health. So we're really truly adding years to your life when you can clean it up in your mouth. Yeah.
Well, and that's, again, back to the research, as one of our research studies also show that that Juice Plus significantly reduces inflammation in the body. And so it would only make sense that it would be that foundational thing that would make so much difference for people. So that's so exciting. It really is. Well, why do you feel now, why is this so important at this time?
Wow. I really want to acknowledge that, oral health may seem trivial in the wake of what we're going through right now. But I really want to express, and reemphasize that Juice Plus is foundational, and it's a must for anyone who is healthy and who wants to get healthy, preventatively. And so it's important to really kind of deliver the answer to that question in two ways. So I really have such a strong passion for helping people because of what we went through with my daughter, who is healthy today. And, there's a lot of people out there that have no idea because they wait until they're in pain, and they wait until there's pus or bleeding or any kind of, decay going on, active decay or disease in their mouth. And they don't necessarily think that they have any control. They don't feel like they have any hope. And yet what's really important to note is that we do have control. We do have hope. And it's very, very, it's actually probably the quickest recovery time that you can see. Sometimes medically we can't see, obviously, down our throat into our bodies. And that's what science is for. That's what all the testing and blood work is for, and different tests that they can do on us. But what's important to know is that we can be our own dental detectives. We can actually see inflammation decreasing in our mouth. And if you just listen to those two areas that I mentioned, including the preventative part, which is flooding your body with antioxidants, fruits, veggies, berries, and omegas, and bridging the gap with Juice Plus, the quad, the fruit, berry, veggie, and omega blends. It's amazing because I have seen such a big difference with that. And it's really important nowadays because there's so many people that are so focused on so many other things in life, and there's so much stress and so much worry about so many other things that they don't have control over. Well, guess what? If you can focus on this one area of your life to really take the time to take control over this, I guarantee you're going to see a difference. I guarantee you're going to see the bleeding decrease, if not go away completely. And that's really, really amazing because, all of what I just talked about, whether it's signs or symptoms of bad breath or dental caries in your mouth, it's all a statement that your microbiome, your oral microbiome, is out of balance. And so you can actually, the quickest way to really get that corrected is by flooding your body with Juice Plus and with the Omega Blend. And so the other part of the answer, why it's so important is, and this is the part that's super emotional for me because it's so fresh, but so my husband and I sold my practice, but I remarried a dental classmate of mine 6 years ago, and he has a separate practice. Well, I inherently just said he had, We don't know. Our practice is closed right now. As of a week ago, our practice is closed. We are so scared for our team. We basically had to lay off our whole team, which is about 25 people. My husband and I are not getting paid from dentistry right now. But guess what? We are getting a check from our business, which is Juice Plus. And so, it's super important to understand that sometimes you don't know. Circumstances, especially for many of us, are changing. And so it's really important to note, and that's what I'm trying to share with the world, literally. I'm trying to tell them, listen, we're going through what we're going through. And we may not have a lot of control over what is happening out there, but we do know a lot about our company. We do know a lot about our products, and we do know a lot about the hope that we can shine on other people and their circumstances. And guess what? My husband and I are two of the people as an example. It's something that we never thought our practice could close down, especially the government telling us we had to close our doors and not knowing when we can open our doors. They tell us a date, but it keeps getting moved. And so it is very scary, but guess what? The certainty and the fear is definitely, overshined, or what's shining brighter is our business. And before I got on this call today, you should have seen my husband was beaming, and he's an introverted person. He was beaming at the idea of me sharing this today and tonight. And I'm just so proud of, the time that we have together now. We have this time at home together, and we've been working on this business together, and it's such a blessing in disguise. And I want to leave y'all with this, that I want to really ask you, what is the silver lining for you? What is the silver lining going on, with everything, swirling around you, whether it's the news that you're watching, whether it's, the conversations that are happening around you, what is the silver lining? And for me, the silver lining is family, being able to spend time here with my family, with our kids, and with my husband, who is typically working, excess of 10 to 12 hours a day, because he has a 3-hour commute every day. To me, that's the silver lining, to be able to work this business. And now I have an even stronger why than I had before. 10 years ago when I said yes to this product, to get a discount on the product, I never would have thought that it would have been a business that could potentially be paying my mortgage, be paying our bills, and that's where we're at today. And so I just wanted to shine that this is my silver lining. That's what I'm focused on. And I want to ask you all to really focus on what is your silver lining.
Thank you so much, Dr. Suzanne Phillips. I'm just so proud that you've been on our call tonight, and really shared your heart totally, and I think really connected with all of us as well. From a standpoint of being blessed, we are truly blessed, I think, with where we are as a company, as a community. We're blessed with products that support our bodies very well and can reach out to those that we love and care about to do the same. If we talk about the studies, and you did that so beautifully, and the studies are extensive. We have right at 40 research studies now that, same hospitals and research centers that do all pharmaceuticals and do it at the highest level have certainly been the ones to do research on our product. And 4 of those research studies, have proven that there is a healthy increase in immune function. So once again, a very powerful thing for our bodies at this time. And the fact that we do have this network, this community, this connection that we've had every Monday night for 30 years to support each other. But at this time, I think it really is our call to action as far as sharing what we have with everyone from our heart as well, because we find ourselves in the same situation. Everybody does. Our company's COO, Sean Hopkins, was on the line with us this morning, and questions like, will we ship on time? Will we be able to handle the increase in business and the desire that people have for our product? And absolutely yes. We do control our own shipping and delivery as far as our products are concerned. And we have always worked at having a very safe backlog of products. We're good for months and months going forward. And, of course, there's nothing that stops our production because we source all of the ingredients, the food, from here in the U.S. So we're safe in that regard as far as our businesses are concerned. But more importantly, is we have something that really makes a difference for people at this time, in both huge stress related to health and health issues and huge stress related to economics. So, again, for everybody on the line, it's an honor and a pleasure to work with each one of you and just value and love you so much. And, Suzanne, thank you so much for your input tonight. And for all of us, as I said, it is definitely a call to action and a moral responsibility to reach out to everyone that we know. And so we'll say goodnight to everyone, and thank you for being on the line. And once again, thank you so much for your input this evening. And for everybody on the line, we'll be talking to you soon. There will be lots of things on Zoom for us to connect with. And fortunately, we have the skill of helping other people learn to work from home and being to see each other through technology. Good night, everyone. Thank you.
Good night. Thank you.
Thank you. Thank you.